While cancer deaths in the U.S. have decreased in recent years, experts say one age group has seen an overall rise in cancer rates: younger Americans. William Brangham has the latest on these shifting demographics and what can be done to address it.
They're called early onset cancers, which means cancer among adults under 50, and they are on the rise. A groundbreaking report from the American Cancer Society looked at rates of 34 different kinds of cancer over several decades and found that 17 of them were more prevalent in millennials and Gen Xers. So what is going on here? Dr. Karen Knudsen is the CEO of the American Cancer Society. Dr. Knudsen, thank you so much for being here. I think the findings in this caught a lot of people by surprise. When you look at the overall study, what stands out most to you?
Well, there are some surprises here, but in fact, we've been seeing some early indicators about this rise in cancers at an earlier age over the last several years. Early onset colorectal cancer, I think, was the canary in the coal mine here, where we saw declining incidence in populations in the 65 and above, but rising in those that are 50 and younger. These are ages for which we'd previously not thought about someone being at risk for colorectal cancer. So clearly something is changing. And this new study highlights that with 50%, as you said, of the studies of the cancers that we looked at on the rise in Gen Xers and millennials as compared to baby boomers.
Do we know why this is happening? Because again, I'm no oncologist, but the traditional understanding is older people tend to get more cancers. You get cancer as you get older. Why is this happening with younger people?
So what that is true, not for all, but for most cancers, age is a risk factor. So that is without question true. But when we look at these cancer rates, they are sometimes 2 to 3 times higher in incidence for the Gen X and millennial population as compared to baby boomers. So when we look at those data, we think that the typical risks are still at play. Obesity, 10 of those 17 cancers are linked to obesity. Lifestyle, so a sedentary lifestyle, of course, increases cancer risk alongside an unhealthy diet, lack of fruits, vegetables, grains, fiber, etc. So we know that those typical cancer risks are at play, but there must be something else because these rates are so different as compared to the previous generation, the baby boomers.
One of the things we also are concerned about is if you get cancer, whether or not it ends up ending your life. What do we know about cancer death rates?
That's right. So when we actually looked in these three different age populations, we could follow cancer mortality as well in a subset of them. And we saw five